health insurance plans for foreigners. Health insurance in Australia for expat and foreigners. Australia is one of the most popular expat destinations in the world. It has an expectationally high standard of living thanks to its low population density, long life expectancy, high standard of literacy and education, and excellent standards of public health care. In fact, according to the Human Development Index, Australia ranks 7th in the world for quality of life. Expatriates no wonder expatriates love it. No wonder expatriates love it. And as they settle in, they will find that Australia public health care has a lot of benefits for them. This is what they need to know about public and private health insurance in Australia. Overview of Australia's public health care system. Australia has a system of universal public health care known as Medicare. It is delivered through a combination of private and public service. One of the public side and public hospital, community service, public health initiatives, and government-based organizations. The private system includes private hospital and clinics, pharmacies, and doctor in private practice who provide care to the public, billing the government directly when they see patients. Public health care is funded by the federal government through taxes levied on salaries. The majority of taxpayers contribute 2% of their income to pay for Medicare. Those who earn little to no income have this contribution waived. Private health insurance in Australia. Approximately 50% of Australians have private health insurance, and this number is growing. The Australian government is actively trying to encourage high earning individuals to take out private insurance policies to augment their public coverage. This is part of program to relieve the pressure on public facilities and reduce wait time. In fact, high earners face an extra tax unless they carry private insurance. Given that health insurance coverage Given that private health insurance coverage is usually more economical for younger people, it makes sense to acquire it early on, even before you hit the salary threshold. Pros and consequences of using the public health system. Australia has an excellent public health care system. However, the system is not perfect. There are waiting lists for specialist appointment and elective treatments. As well, travel is often necessary in order to access specialist care is in rural areas. Thus, most expect in Australia opt to have private health insurance to supplement their coverage for the public Medicare program. As an added benefit, private health care means being treated in facilities that are more comfortable and private with shorter waits and a greater choice of physicians. However, as many expect will assets, private healthcare facilities do not extend into the realm of emergency service. And in many rural and remote regions, emergency service play a more prominent role in providing health care. Therefore, even in an expat prefers the level of care and comfort offered through private insurance, it is still well worth applying the public coverage through Medicare. You never know when you will need help such as emergency service, and it is best to be covered when you do. Can expect qualify for health insurance in Australia. Medicare is available to all Australian cities and permanent residents. Therefore, all expats who qualify as permanent residents are eligible for coverage. However, this does not mean that all visitors to Australia can receive Medicare. In particular, all expats moving to Australia with a working visa and non-permanently residences are not eligible. In fact, they must prove that they have adequate private health insurance or they will not receive your visa at all. Furthermore, all tourists and other short-term visitors to Australia should carry their own private travel medical insurance coverage.